Getting to the root cause of trigeminal neuralgia. One of the biggest problems that I see in patients is navigating between the three types of TN that we face. Type 1, type 2, type 3. And I think one of the biggest struggles that we encounter is, what direction do I take? Well, first line of action, the first response that almost 99% of people are going to take is to go to their dentist. They are going to be worried because that pain that comes in through the jaw, fall down through this region right through here, is a distribution that is common with tooth pain, right? And at first we may think that it is a tooth because you may be sensitive to cold, sensitive to heat on liquids. You may be, the cold air may come into the mouth, it may cause some problems. The warm air may cause problems, right? It's something that can be evoked, or something that you can cause by drinking hot water or drinking cold water, right? Like, that's the idea behind this. So you're gonna go to the dentist. The dentist is gonna check your mouth out, and he is going to assess you for any form of a cavity, any form of a tooth break, something along those lines, right? However, if your dentist is not educated in TN and does not offer a cone beam CT, you are in for a world of hurt. Because if in fact you do have an abscess, or you do have what is called a cavitation from a prior tooth surgery or tooth removal years and years and years ago, because that's obviously what happens most of the time with TN patients, they'll be missing it. And you'll be trying to go down this rabbit hole of finding solutions for it. So my first recommendation is that if you truly are a type 1, it is truly oral related TN, that you find someone who can take a cone beam CT, has heard of something called a cavitation or an abscess, and it is ruled out. Now, for the rest of you, type 2 and type 3 are once you have gone to the dentist, once you have ruled out all of those situations, and you have now moved on to your PCP, to your neurologist, to your ENT, and we're getting carbamazepine, we're getting gabapentin, we're getting tramadol, we're getting all these medications thrown at us because the pain is not going away. Well, for a little anatomical lesson, if we talk about TN being the branch of your trigeminal nerve that takes care of the sensory and the face in this region, right? We have to understand that anatomically, the trigeminal nerve actually originates its root in the first and second and third cervical bone, right? So that nerve root extends all the way down to C1, C2, C3. And what we often see missed when it comes to TN is that a patient with a prior history of a neck trauma, of a car wreck, of a fall, a slip, a trip, a concussion, etc., 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 compounded over time, can in fact irritate that nerve root, giving you the sensation of having TN, right? It is usually unilateral, one-sided, etc. So if you have ruled out type 1, you more than likely have an upper cervical spine problem for a type 2 or a type 3. Now, see, what's really fascinating is that the neurosurgeon loves to cut open the back of your skull and just come in with a pair of scissors and cut that nerve. That makes no sense. That's absolutely insane. Now, I understand that some of you get to this end point in your life where you're like, man, I've been navigating TN for years and years and years. I'm going to go ahead and get the gamma knife. I'm going to go ahead and get the microvascular decompression done. And I want to encourage you to not go that route. I want to encourage you to find a competent upper cervical spine doctor, someone who knows and understands the neurobiomechanics of C1, C2, and its implications of a misalignment impacting the autonomic neurological system, more importantly, interfering with the ability of the trigeminal nerve to properly perform its day-to-day tasks. And I promise you that if you find the right one, and if you find somebody who knows how to not only assess your nervous system, but two, knows how to assess your upper cervical spine, they will be able to restore normal upper cervical biomechanics to alleviate autonomic neuropathophysiology and to restore normal nervous system function to your body over time. This is super, super important for you to understand because you do not have to learn to suffer from TN. Yes, there are those instances where it is a tooth problem. You need to go to the dentist. You need to have a cone beam CT done. You need to rule out abscesses. You need to rule out cavitations. You need to get that mercury, that titanium out of your mouth, right? That all definitely needs to be done. However, if that is not you, or you've already gone through that route, I am going to beg you and plead with you to choose the route of an upper cervical doctor because we will forever transform your life. I'm in Southlake, Texas. I run Hope Upper Cervical Spine Center. I am happy to refer you to upper cervical doctors throughout the United States. We use a really great directory called uppercervicalcare.com. And in that, we can navigate discussions with other doctors to find out, hey, I got a patient with TN. They're looking for help. Do you have the ability to help them? Remember, there is always hope, and you do not have to suffer from TN. Type 1, type 2, type 3. Root cause is always your neck, unless it's a problem with the tooth. That, my friends, is how you start the process of navigating TN.